Well, good evening, good evening, good evening, Lupus warriors all around the world. And how are you guys doing tonight? I hope this video finds you doing well. I would like to personally welcome you to another episode of Lupus Facts brought to you by yours truly, Laura's Lupus channel. And hello, if you don't know me, my name is Laura and this is my channel. I created this channel in order to bring about awareness, to educate, and to encourage lupus warriors like you and I created this channel with the thought in mind that I wanted a community in which it was a safe place that we could talk about difficult things. Um, Lupus can be a difficult journey. It can be a very hard disease. And so, as lupus warriors, both individually and collectively, you know, uh, we need to talk about the difficulties that we experience on this lupus journey. Okay. And so this is a safe place that we can do that. And so tonight I'm going to be talking about a very important battle that I think mostly all of us as lupus warriors that we can relate to. And as you know, as lupus warriors, we face many battles, but I think what we're going to talk about tonight on this video is in the top five. It's one of the battles that I can say that we've experienced individually and collectively as a lupus community. And with this battle, sometimes we lose and sometimes we win. And so, what is this battle that I'm talking about? Sleepless nights, not getting enough sleep. Okay? But today we're going to talk about the other end of the spectrum, in which sleepless nights is not just a few days or a few nights of sleepless nights. There's a medical condition that causes a person um, not to be able to get enough sleep, not only for days, but this is the other extreme of the spectrum where it goes on for weeks, months, or years. And like I said, sometimes we win this battle and sometimes we don't. But you know what? After so many times of losing the battle with sleep, it can become problematic. Okay? And so what am I talking about tonight? Well, today's topic is going to be about insomnia. Insomnia. And insomnia is more than just a few nights of not getting enough sleep. Insomnia is a very serious illness that can impact every area of our lives. And when I think of insomnia, I think about Michael Jackson. As we know, that was one of his struggles. Michael Jackson struggled with insomnia for years, mostly all of his adult life. And it led to such sleep deprivation that he tried anything and everything just to get a good night's sleep. He even resorted into trying things that endangered his life. And one of the things that we know that not only endangered his life but took his life was taking a drug that was used for anesthesia during surgery called propofol in order just to get a few hours of sleep. That's how serious insomnia can be, okay? And so let me just say this before we get into the video, that I am not a medical professional, okay? I'm not a doctor. And the information that I'm going to present to you tonight on this video is for informational purposes only. But if you find yourself dealing with any of the signs and symptoms that I've mentioned tonight, or if you're having any type of sleep issues that's been going on for a long period of time without any type of relief, okay, please consult a medical professional, okay? Because things that can cause sleep issues doesn't just involve insomnia. It can involve a sleep apnea, narcolepsy, but for today's video, I'm going to be discussing insomnia because insomnia does impact lupus patients on a greater level than what we think. Okay, and so I wanted to make sure to get the information out there regarding insomnia and to know that there is help for insomnia. You don't have to struggle with this alone. Insomnia can be caused, psychologically, or there can be a physical cause for insomnia. And that's the reason why it's so important to consult a medical profession if you find yourself anywhere in the spectrum of symptoms that I'm going to discuss on this video tonight. Okay, so let's jump right into the video. In order to understand insomnia and the seriousness of insomnia and how it can impact every area of your life, we need to understand the signs and symptoms of it. And so tonight I'm going to be bringing you a few facts, at least 8 of them, that can definitely let you know that you could possibly be experiencing insomnia. And the first one on the list is the fatigue. Fatigue. And the fatigue comes from the difficulty falling asleep or staying asleep. Okay, anytime we have a problem falling asleep, we get into bed and we can't go to sleep. Our body is tired, but our brains stay on. And this goes on for weeks and weeks, or months and months, or years and years. How many of you know that can be problematic? Also, one of the symptoms that of insomnia that can cause the fatigue, that's connected to the fatigue, is waking up earlier than usual. Let's say you normally wake up at 6 a.m., but for months you found yourself waking up like clockwork, 7 days a week, at 3 a.m. And just think about how this can impact if you have other obligations during the day. If you have work life, school, if you're a parent, if you have any type of obligations that you have to take care of during the daytime, imagine how that can impact your life in a negative way. Okay? Number 2 is low energy. And this low energy comes in the form of feeling tired, even after getting some sleep at night. It comes in the form of daytime sleepiness or grogginess. You may find yourself needing to take a nap, desperately needing a nap. Or you may find yourself, daydreaming or dazed out. This could be a sign that you have been experiencing insomnia. Number 3, difficulty with concentration and focus. And the concentration and focus, the difficulty with that comes in the form of just feeling scattered. You're losing things more often. You can't think, like you were sharp at one time, but now your thoughts are all over the place, or you're forgetting important things. um as far as like your conversation, the thoughts that are in your mind, you're not able to communicate that effectively, or you're just all over the place with your communication. You're just all over the place with life. One minute you're focused, here, and the next minute you're focused over here. If you're in school or on the job, you're having a hard time paying attention and focusing on the task at hand, or focusing on the information that you should be processing. You're having a hard time with that. Also, there could be comprehension issues with this. You may find yourself again, if you're being presented with information, you're just not grasping it, or you have to read a passage, or you have to be told something over and over and over again before you finally get it. Okay? Number 4, with insomnia can cause a person to feel irritable and agitated. Things that normally wouldn't agitate or irritate a person becomes an issue for that person. And I love to give the example of a mom and her kids. You have kids, they're going to spill things on the floor, and so your child spills milk on the floor. And this is something that normally you would correct, you guys would clean it up, and it would be over and done with. Well, when you're dealing with, weeks and weeks and months of insomnia, this will irritate you. You find yourself reacting in ways that you normally wouldn't react. You find yourself making a big deal about things that were not a big deal to you before. You find yourself easily agitated. Things get up under your skin. Things get on your nerves, much easier. And so, That's one of the telltale symptoms that comes along with the mood swings. Also, insomnia, and the signs and symptoms of dealing with mood swings due to insomnia. Person can have bouts of depression and anxiety. Well, if you think about it, dealing with sleepless nights for long periods of time, that can cause depression. It's a medical fact in the medical field. It's a proven fact that insomnia or lack of sleep can cause depression. Now, there are other things that can cause depression, such as chemical imbalances and everything. But for the purposes of tonight's video, we're going to refer to insomnia causing depression. And so, what happens with that is that if we can get the person on, a healthy sleep routine, get them feeling, the right amount in quality of sleep and the right amount or recommended amount of sleep, where they wake up in their sleep, they feel rejuvenated and refreshed, then a lot of times the depression and anxiety symptoms subside when we take care of getting a person into a good sleep pattern and getting good quality sleep. How many of you know that a lack of sleep can impact the quality and your enjoyment of your life? Okay. Um, Number 5, problems with work and school performance. Now, this is a big one. Um, One example of that is failing grades. A person may have been an all A and B student at one time, but due to the struggles with insomnia, they find that their grades are starting to decline. They start getting C's, D's, or E's. There's an increase in errors or mistakes on their homework, or an increase in errors, an increase of errors or mistakes on at their job performance. The boss is always having to bring work back to you because of the numerous amounts of mistakes that you've made. Everyone makes mistakes, but some of us, we've been doing this job for so long, and we have such a great skill set at it, and we're professionals at it, that a lot of times we can do this job with our eyes closed and our work performance is flawless. But when you're dealing with insomnia, you're going to find that you start making more errors and mistakes, not just on the job, but errors and mistakes and lack of judgment in the areas of judgment. Okay. Also, on the job, you find yourself unable to complete projects that you're assigned to. And this can be in school too, especially if you're in high school or in college. You'll find yourself not being able to complete projects. You're not meeting the deadlines. You're not, when the boss comes to check to see where you are on a project, you're not meeting the milestones. There's a deadline and you're not even halfway through the project. So the boss has to call on other people to help you complete a project because you've missed so many deadlines. A project that normally would, a one person could complete alone, now the boss is having to take other people off of their projects to help you to complete yours. And so that's where it becomes a problem with your work and school performance. Also, we find that sometimes there can be some coordination issues, walking, hand and eye coordination, um, thought and speech coordination. Communication is scattered. It's not as effective. You have a problem um, communicating your thoughts in your head, in an understandable manner to someone. Um, Again, your thoughts are scattered, your communication is scattered. Also, due to coordination issues, you may become more accident prone, dropping things, forgetting things, tripping over things, falling. You may find yourself having more fender benders or car accidents than what you've ever had before. You may have a perfect driving record, or you may find yourself getting into an accident or having problems due to falling asleep behind the wheel. And that can be related to insomnia. Okay. Um, Number six, a person may experience tension headaches. And so you may ask, what is the difference between a regular headache and a tension headache? A tension headache is one where it normally happens in the temples, but it can happen not only in the temples, but all the way around the head, all the way to the back, the base of the brain. Okay. And what happens is that it feels like someone has a band around your head and they're pulling it tighter and tighter and tighter, with no relief for you. Okay. And so that's what it feels like to have a tension headache. Number seven, a person dealing with insomnia may find themselves dealing with more stomach issues. They may fluctuate between constipation, diarrhea, acid reflux, pain in the stomach, gassiness, you know, slow elimination. A person may be accustomed to having eliminating every day, and maybe that slows down to maybe every 4 or 5 days. Okay. And number eight, last but not least, whenever a person is dealing with insomnia, they start to worry about sleeping. Sleeping is the main focus, especially at night before it's time to go to bed. Going to bed, getting ready to go to bed at night becomes a source of stress instead of a source of relaxation and relief, because they failed, not failed, but they've lost this battle to sleepless nights so many times that they know when they get into bed, they're going to fall into bed and they're not going to get a good night's sleep, or they're not going to be able to sleep at all, or their sleep is going to be interrupted, or they're going to wake up earlier than usual. And so when this happens time and time again, going to bed at night becomes a source of stress for a person. They dread at night. And then also it brings about feelings that you're the only person in the world that's dealing with this. You lie awake in your bed at night and you feel like everyone else is sound asleep and getting a good night's rest except for me. And that can be very stressful for a person. Okay. But I'm here to encourage you that if you are dealing with any of these symptoms, if you are struggling with insomnia, again, you're not alone. You're not the only one. I can say that as lupus warriors, all of us have battled with episodes and bouts of sleepless nights, but there is help available out there for you. You don't have to go through this alone. Okay. And so I'm going to wrap the video up at this time. Make sure to join me for the next video, because on the next video I'm going to talk about some tips as far as helping you to get a good night's sleep. Okay. But don't forget that if you're dealing with any of this, there are tips out there, and I'll be providing that on the next video. But there are medications and other things that can help with insomnia. You don't have to struggle with this all alone or for long periods of time. All right. And so thank you for joining me. As I say at the end of every video, there is life after lupus. You know, um, take care of yourself, my friends. Stay strong, stay blessed, stay encouraged. And, get this. If you enjoy the content that I'm presenting on my videos, please take the time to hit that subscribe button, hit the bell so that you receive notifications every time I upload a new video. And I do that on a regular basis. Also, make sure to hit the like button, to comment. I enjoy reading your comments and responding to those. And then also, my friends, share the information. By sharing the information, you're getting, important information out there to lupus warriors all around the world. By sharing the information, you're also helping the lupus community as far as, earlier diagnosis for lupus patients. And then also, get this, this is the most important thing of all, that by getting the information out there and helping both lupus warriors and the medical community to understand lupus and what we go through, we also not only help with earlier diagnosis, but also one day have finding a cure for lupus and totally eradicating lupus from the face of the earth. Okay? So subscribe, hit the bell, like, share, comment, and I'll talk to you soon on the next video. Bye for now, my friends.